Hi everyone, Eileen Davidson here, aka Chronic Eileen, and the Educational Media Assistant with AiArthritis. Last month, I attended the 2025 American College of Rheumatology Conference in Chicago, and I went to a couple different sessions on physical activity and exercise and how that impacts people living with different autoimmune and autoinflammatory forms of arthritis. I myself live with rheumatoid arthritis and huge fan of exercise because along with my medications, I find it to be one of the most impactful treatments that I can do for the amount of chronic pain and fatigue and everything else that comes with living with an AI arthritis disease, because we all know it's much more than just joints. These are often systemic autoimmune diseases that affect other parts of the body, like the brain, the heart, the lungs, skin, eyes. So exercise doesn't just help our joints, but it helps other parts about our disease. And there is a number of speakers that really emphasize why exercise isn't just optional. So the two sessions that I went to that I will be talking about is physical activity, stress management, and nutrition to improve outcomes in rheumatic diseases, bringing the science to the clinic and high intensity training in rheumatology, impacts on cardiovascular health, physical function, and immune response. These were very interesting topics, and they really highlighted how it's so much more than a pharmacological therapy. So, exercise is not optional, it's a foundational component of care. They distinguish that general physical activity, which is our daily movement, from structured exercise programs like aerobic and resistance training. Aerobic activity, such as walking, swimming, or cycling, supports the cardiovascular health, while strength training enhances joint stability, functional independence, fatigue management, and metabolic health. Again, super important because these are systemic autoimmune diseases and it's so much more than joints. So, strength training was described as the missing link in rheumatology care. And I can definitely agree with that, having been involved in a number of studies with Arthritis Research Canada and strength training. Only about 14% of people with my disease, rheumatoid arthritis, actually strength train. But it should definitely be a lot more because it helps preserve muscle mass, it improves mitochondrial efficiency, and support long-term health function. Even in patients with joint damage, clinicians were encouraged to access muscle strength and functional capacity rather than relying solely on weight or BMI. And I think that's a huge thing because we all have different types of bodies. I think it's much more important to rely on how strong we are, how much we can function rather than just our weight, especially since people with rheumatoid arthritis tend to actually carry a little bit more adiposity tissue fat. So we could still be very healthy, but still have some fat on us because that's actually very common with people with rheumatoid arthritis and other forms of inflammatory arthritis. So they went over how high intensity interval training, HIIT, was highlighted as safe and effective for inflammatory arthritis. Studies also showed that short bursts of vigorous exercise, followed by recovery periods, can improve our cardiovascular fitness, crucial given the elevated risk for cardiovascular disease in autoimmune and autoinflammatory arthritis patients. It also helps reduce disease activity and improve immune function, including T cell capacity and monocyte profiles. So that's really cool because it can actually help reduce inflammation. And we need that. We need all the help to reduce inflammation when we live with inflammatory form of arthritis. It also helps enhance muscle metabolism. So this also supports the immune regulation and reducing inflammation. It also helps, and I think this one's really important, reduce fatigue and overall physical function, even in older adults or those with established joint damage. So it is safe to exercise even if you do have arthritis. It's just knowing how to exercise when you have arthritis. There's a lot of adaptations that need to be met and talked through with a exercise professional. So really interesting that it also helps reduce fatigue because fatigue is my most debilitating symptom, even though I live with a disease that most people think is just chronic pain, but it's so much more. So they also kind of emphasize that Personalized prescriptions using FIT. So principles, what that means is frequency, intensity, time, and type, and gradually increasing intensity to match the patient's capacity, which will change. And then also how recovery days are also important for maximizing benefits and reducing or minimizing soreness after exercising, which can happen when you live with a rheumatic disease and live with chronic pain. And they also went over how stress management was really important into controlling inflammation. So chronic stress activates inflammatory pathways, and these worsen disease activity and fatigue. Stress reduction strategies presented at the session mostly included mindfulness-based stress reduction, cognitive behavioral therapy, guided imagery and breathing exercises. So there's one that I keep seeing kind of going around is where you inhale for 4 seconds, hold for 7, and exhale for 8. And you repeat that a few times, and then actually does help reduce a bit of anxiety and just relaxes you. So remember that's inhale for 4 seconds, and then you hold for 7 and exhale for 8. Feel free to pause this and try that. There was also mind body practices talked about, such as Tai Chi, yoga, or Qigong, depending on which one best suits you. Remember, you're going to do these things if you enjoy doing them, so find the ones that you do enjoy doing. And then they also noted that like social connection, positive engagement, and enjoyable activities are not just optional. They are essential to having anti-inflammatory practices. Reducing stress has measurable effects on the immune system modulation, including reduced inflammatory biomarkers and improve overall function. So really important to not just be physically active, but reduce stress. Now, they also went over nutrition, food as medicine, hot topic, and more evidence is really supporting that certain food patterns or diets can actually help when living with a rheumatic disease. It's not just some fancy diet, though, it's actually more of like I call it food map because diet is very kind of limited and I find it more shameful at language rather than, okay, this is how I can apply healthy habits into my life. So I like to call it a food map. And what they went on about was nothing that I haven't heard before, but always a good reminder. So minimal processed food, adding more colorful foods rich in phytonutrients. So that's lots of vegetables of different colors, dark leafy greens, bright oranges, reds. They all have different types of phytonutrients and all the healthy things that we need in them. So don't just stick to one, stick to the number of ones that you will eat. Of course, omega-3 fatty acids. This is from fatty fish, flax seeds, and chia seeds. They also emphasized on whole grains, so you don't need keto. You just need to focus on whole grains. Fruits, vegetables, nuts, and seeds. And of course, the Mediterranean diet and plant-based dietary patterns were consistently mentioned as the only ones that have evidence backing up their effects on a number of different illnesses from cancer to cardiovascular relief to rheumatic diseases like we have. Diet's a huge component into holistic ways that we can reduce inflammation. Supplements may support care in select patients, including like vitamin D, which is actually really important to where I live, being up north in Canada. Almost everybody here has a vitamin D deficiency in winter. That is definitely a vitamin or supplement that should be included for a lot of us living with rheumatic diseases, but also making sure that you are considering dosing quality and the potential interactions that a lot of vitamins might have. It's really important to speak with your rheumatologist or a registered dietitian or a pharmacist about which supplements are best for you. So fish oil and turmeric are very common and actually have some evidence behind them. However, turmeric might have some interactions that will either not work for you with certain health conditions or comorbidities or also certain medications. which is something that you need to speak to your pharmacist or rheumatologist about. So they highlighted the importance of individualized nutrition counseling for rheumatic disease and people living with AI arthritis, and how that the growing role of the microbiome profiling in guiding dietary interventions is getting more popular and also very important. They also highlighted resources like Natural Medicine's database and Consumer Lab to help ensure evidence-based recommendations are accurate. So not just some MLM supplement that somebody's second cousin twice removed recommends you. Of course, they talked about how integrating lifestyle medicine into the clinical practice requires creativity and collaboration. And they kind of talked about collecting a family history during visits. So talking about like how did the person like learn to become physically active? How did they grow up in a family that wasn't very physically active, or maybe they used to play sports, but now they can't, kind of thing like that. And then using physical activity as vital signs to assess baseline movement, which is, I think, really important because these are debilitating conditions where, daily functioning, being physical can be really difficult when living with a rheumatic disease. They also mentioned how applying motivational interviewing to promote small, sustainable behavior changes can actually really help. And then they really recommend collaborating with allied health professionals such as dietitians, physical therapists, and occupational therapists. Of course, this is also highlighted in the 2022 American College of Rheumatology treatment guidelines or integrated treatment guidelines for rheumatoid arthritis. Physical activity and physiotherapist was the only treatment that was highly recommended for people living with rheumatoid arthritis, and that's because it has so much evidence behind it. And yeah, it says that lifestyle medicine, it's not a replacement for medications, but a critical component that can complement and improve outcomes and function and quality of life in people living with AI arthritis. So it is not going to replace our medications, but help make our medications work better. So the main takeaways were exercise is essential, both aerobic and strength training. This is to improve joint function, help reduce fatigue, improve cardiovascular health. HIIT is a great, safe exercise that can reduce disease activity and enhances immune function. Stress management is therapeutic. So, considering mindfulness, cognitive behavioral therapy, guided imagery, breathing exercises, mind body practices, these can help reduce inflammation and support our mental health as well, which is just as important as our physical health. Nutrition is also medicine, emphasizing minimally processed, nutrient dense food, Mediterranean or plant based food maps, and carefully selected supplements that you speak to your rheumatologist and pharmacist or registered dietitian about. Personalized care really matters. Exercises need to be tailored to intensity, diets need to be tailored to dietary choices, availability, cost, all sorts of different factors. So it's no one size fits all for everyone. And yeah, lifestyle medicine is foundational. And just remember that the next time that you're trying to take some steps forward into creating healthier habits for yourself, and know that the research presented at the American College of Rheumatology in 2025 really highlights some of these. I hope that these little golden nuggets of information from the sessions that I attended on lifestyle interventions helps you today. And till next time.